Summit Hearing Solutions wants you to fix your hearing, not just to reconnect with your loved ones, but to help keep other parts of your body healthy. Ted, here to tell us more.
Yes, we're talking about cognitive decline. It's actually a relationship with your hearing and your brain. We don't talk about everyone wants to talk about hearing aids as being a commodity or something to just make things louder. We're looking at the way that your brain takes the signal from your ears and uses it to create hearing, and how your temporal lobe of your brain, which is your processing portion, actually recruits other parts of your brain to help you hear when you have a hearing problem. Thus, when you are lip reading or trying to keep up with conversation, your cognitive abilities decline 30 to 40% faster when you have an untreated hearing loss. And that also leads into something that's a little bit more dangerous, is how much hearing and untreated hearing loss and dementia are related to each other. A mild hearing loss, 2 times more likely to develop dementia in later years, 3 times at a moderate hearing loss, and a severe hearing loss, untreated, up to 5 times more likely to develop dementia. That is a really scary statistic, if you ask me. And of course, we have balance.
Right.
When we're talking about balance, we're talking about our ears are connected to our balance system, and our brain is connected to our balance system. When you have an untreated hearing loss, you have a higher chance of actually falling and having a little bit, and there's also some confusion that goes along with that as well. So at Summit Hearing Solutions, we really dedicate ourselves to understanding how the relationship with the patient's hearing and their brain, and how we are going to learn how to hear again, how we're going to get the best possible signals to the brain so they can have the best experience with their hearing correction.
You've talked before that hearing is one of the senses, one of the few that is on all the time.
All the time.
Your brain is supposed to be getting hearing signals all the time.
Continuously.
And so when that's not there, obviously it's going to, your brain is going to kind of, I don't want to say wear out, but I mean, it's just, there's parts that aren't being used.
Well, it's called auditory deprivation. Just like if you don't use portions of your muscle tissue, it starts to atrophy. Same thing happens with your brain, with the processing portion of your brain, and also the nerve endings inside your cochlea. It starts to atrophy. And with the brain, it's a remarkable organ, obviously. It starts to redirect the energy that it should have in this one particular area of your brain for hearing, and it starts redirecting in other portions of your brain. And SPECT scans from Dr. Anu Shamra from the University of Colorado, Boulder, does studies on this, where she does SPECT scans of the brain of a person that is listening to speech tone with a mild hearing loss uncorrected, and that same mild hearing loss that is corrected, and you can actually see where the brain is actively working.
Yeah, and again, the other thing I love is that you tell people all the time, you didn't lose your hearing all at once, most likely. It's a process to bring it back, but you guys are committed to the process.
That's exactly right. It's a journey, and if there's no such thing as a silver bullet to do a correction when you're dealing with the brain. You're right. It was a process and actually a paradigm of loss, and we're going to create a paradigm of correction as well. And we want to make sure that our patients understand that this is not going to be something that you are one and done. Too many hearing aids end up in a sock drawer because no one went on the journey with them together. And as you see on the screen now, depression is a huge part of uncorrected hearing loss. Think of it being part of a family and not being able to communicate with them properly. You have a tendency to withdraw from that social environment. Thus, the brain does not get its same dopamines and chemicals that it needs to be happy.
Yeah, again, just think of all the jokes you miss and the I loved yous, like your commercial. I mean, so it really is time to step up and make this the year that you start the journey and improve your hearing. With Summit Hearing Solutions, you can do that at any of their offices here or online. You can find out more at summithearingsolutions.com. Give the number on the screen a call. We will be right back on Insight.